I am John Hertig. I am with the Purdue University College of Pharmacy Center for Medication Advancement. We just call it CMSA because it's another acronym for you all to learn. I'm a pharmacist by training, and it's really my pleasure to be here because this is an issue as a medication safety expert that I'm very passionate about. And to kind of frame the next 10 to 15 minutes, I want to use an iceberg as a little bit of perspective. You just heard from Allie, a really compelling patient story. And we see these time and time again, but they only represent a very small subsection of what's actually out there. They're the tip of the iceberg. In med safety, they're the people that actually get harmed that we see or that we read about. But for every Allie, there's 10 other people underneath the surface that we don't see, that are harmed every single day around the world. And there's a really big operation out there harming them. There are close to 30,000 to 35,000 active online pharmacies at any given time globally, with 600 new illegal sites opening every single month. It's a whack-a-mole. Every time we shut one down, 10 more arise, and we're always chasing our tail. 89% of online illegal pharmacies do not require a valid prescription. Not shocking, right? Our illegal pharmacies are not requiring prescriptions. And nearly 95% of providers, like me, I'm a pharmacist by training, and the physician colleagues and the nursing colleagues and the other colleagues that I work with have little to no knowledge about how to identify and counsel patients on safely going on to the internet. We are not trained to effectively do that, and I have some data to back that up. When we look at these illegal online pharmacies, some of the common violations that are occurring, they're selling falsified, adulterated, unapproved medicines. There are some images that'll come up here where these are back alley operations. I can't even call it manufacturing because they're the farthest thing that you can get from good manufacturing practices. Selling prescription medications without a prescription, without a pharmacy license. Clearly, if they're doing something illegal, they're not going to abide by some of our regulations. Because of the quality issues inherent in this type of operation, there's over and underdosing. So even if you do get the right active ingredient, you might get too much of it or not enough. Well, that could be really, really bad from a med safety perspective if you get too much of an opioid or not enough of an anti-infective. There's also interactions, adverse effects, and then financial fraud. We often don't talk about financial fraud. I talk about the clinical side, but realize that these are patients, these are US consumers giving their credit card information out to criminals. So when you talk about financial fraud, when you talk about identity theft, that's a real risk to our patients. Online drug sellers make between $1 million and $2.5 million in sales each month. Each month. Huge business. So there's a huge incentive for these folks to go on and start up these pharmacy websites. And if we create a bigger market for them, if we encourage US consumers to go online, trust me, they will come and they will make their money. Here's some images. Again, these are prescription medications that are coming through Canada, but really being made in Pakistan, India, China. This is exactly what the operations look like. Again, a far cry for our GMP facilities. These are some of the hidden poisons or materials that are found in a lot of counterfeit medications. You may have seen a graphic like this, where we have heavy metals, common household items, no drugs at all, drugs you didn't ask for, and then actual poison. One of my favorites on this list is antifreeze, and you may not know this, but antifreeze is sweet. Don't ask me how I know that, okay? But a lot of illegal online pharmacies and counterfeiters will use antifreeze to cut other drugs to make it more palatable for patients, not realizing that you're getting poison and it could be deadly. So it's a global issue, but here really we're focusing on Canada. And there are a lot of risks associated with these pharmacies in Canada. 95% of the products that are advertised on these Canadian pharmacy websites are non-USFDA approved. That means only 5% of the drugs coming out of here are US FDA approved. There's no way for us as healthcare professionals or consumers to know the conditions within which these medications were manufactured, stored, or shipped. A lot of medications require very stringent shipping and storage considerations, and we have no idea when it's coming out of an alley in Pakistan whether it was stored correctly. And there's representatives from the US FDA that have reinforced that fact. So ultimately, if we take a step back and look at this entire market, it's worth about $200 billion a year, which now eclipses almost everything else in the underground economy, including prostitution, human trafficking, and illegal arms sales. I just said $1 million to $2.5 million a month. This is big business, and it impacts people. We heard from Allie. There are stories just like Allie all over the world. Here are a few examples. They target vulnerable populations, people that can't access medications for one reason or another, who can't afford medications for one reason or another, and they go online and they end up getting hurt. Number of sad stories. Again, look back to the iceberg. This is only the tip of that iceberg, and there's a huge underbelly here. And the issue is that a lot of our patient protections are bypassed online. I'm a med safety guy. This is what I do globally. And I'm very proud of the supply chain we have in this country because we have a lot of checks and balances to keep our patients safe. So if we look at the graphic up here, we have our physicians, right? They prescribe, they monitor, they make sure that our patients are getting what they need. You have the pharmacists there in the middle, right, that are also monitoring. They're double checking the physician's work. They're making sure they counsel the patient appropriately, and they look for abuse. And they look for abuse potential. And then we have our regulators at the state level regulating health professions, but then also at the federal level with the FDA having oversight of drug manufacturers, as well as preventing counterfeit and substandard medications. Our own US FDA has made some statements to the effect that we cannot guarantee the legitimacy of medications that come from outside of the US. And they're right, they can't. And so by ordering online, you bypass all of these protections that we've worked so hard to institute in this country. And now you don't have any of that going on. You have direct ship from anywhere in the world to your door, whatever you want. And one of the things that people want are opioids. So in my state, the great state of Indiana, we have an opioid issue, and I know a lot of the other states feel the exact same way. Well, now we have a situation where you can go online to about 12% of those legal online pharmacies, about 3,400 options, and go buy Percocet, fentanyl, or whatever you want without a prescription, direct ship to your door. 91% of first-page search results take consumers to illegal pharmacy websites, and we have an example up here. Obviously, the strength and purity is going to vary because we just demonstrated the fact there's no quality here and there's no consistency. And US consumers are consistently targeted specifically for these types of sales, where they know that we want to buy them, they will go after us just like any other marketing campaign and sell opioids online. If you go into Google today and you type in Canadian online pharmacy and Percocet, this is what will show up. Of these 7 results, 4 don't require prescription. They say it right there, no prescription needed. And then 2 of them even say that they're foreign, but they're discreet, and they'll ship from anywhere in the world to your door. No questions asked. No questions asked. So when I think about the opioid epidemic going on in my state, this concerns me greatly from a safety perspective. Let's pop open one of these sites. One of my favorites is actually Legal Online Pharmacy. So newsflash, if you have to say you're a legal online pharmacy, chances are you're not a legal online pharmacy. And this is one where we look at Percocet. And another giveaway, this is 10% extra pills, right? This is not a bag of chips. This is Percocet. This is an opioid. And the more you buy, the bigger your discount. Again, you go on the site, you give your credit card information to a criminal, and you get Percocet drop shipped to your door from anywhere in the world. You don't know where this Percocet came from. You don't even know if it's actually Percocet, because it could have been mixed in a back alley in Pakistan. Now, fortunately, we have great people like John Horton and his team, and he'll talk a little bit more, but they're monitoring a lot of these sites for us. But it is whack-a-mole. For every great job that they do, 10 others can come up right behind them, and we're always chasing our tail, and I know we'll have more information on that after my presentation. So you're probably asking, okay, you know, patients obviously struggle with this, our US consumers struggle with this, but I'm sure our doctors and our pharmacists and others can help them, right? Not exactly, not exactly. And some of the research that we did backs that up, where health professionals themselves are unable to determine the legitimacy of some of these sites. What we did is we at Purdue partnered with LegitScript, and the purpose of the study was to determine the gaps in knowledge between pharmacists like myself and the illegal internet drug market. And we did a little bit of survey research. One of the first questions that we asked was, prior to today, were you aware of the existence of illegal internet pharmacies? And the vast majority of our respondents are. They know that illegal pharmacies exist. They know that they're out there and they know they're risky. But 93% believe that that illegal internet pharmacy market makes up less than 80% of all internet pharmacies, which is grossly underestimating the scope of this problem, because really it's 96 to 97% of internet pharmacies are illegal. And so even though our pharmacists know that they're a problem, they don't realize how big a problem it is. The next part of this survey we wanted to do is actually give websites to pharmacists and say, do you think this is legal, illegal, or are you unsure? So if it's your responsibility as a frontline health professional to counsel your patients, you need to probably know whether something's legitimate or not. So this is an example of Blink Health, and this is in fact legal. Our pharmacists got this right for the, well, 44% of them got it right. But over half of them either thought that it was illegal or they were unsure. This is information then they're going to pass on to our patients and our consumers. So if we take a look at this website, this is Drugs Order. This one is illegal. Our pharmacists did much better at 71%, identified this as illegal, but still a quarter were either unsure or got this one wrong. And then this third website, which is very germane to what we're talking about today, is CanadaDrugs.com. We asked our pharmacists what they thought. This is illegal, and only 29% of our pharmacists identified this as illegal. That means upwards of 70% had no idea as to the legitimacy of this particular website. And this is information, again, we're passing right along to consumers. So if our pharmacists don't know and our physicians don't know, how can we protect our patients? We did write a white paper on this, and I'm happy to share that. One of the questions I do want to point out from that paper is we asked pharmacists about their confidence to counsel patients. So if you have to counsel patients on the legitimacy of an online pharmacy, how confident are you? And only 34% of our pharmacists are confident. We are not armed with the skills. We do not have the ability to help patients stay safe online. So from the results from this study suggest that licensed pharmacists like myself are aware of the risks, so we know it's risky, we know the potential for doing harm is out there, but we are unable to determine the legitimacy of these sites today. Some key takeaways that I want to leave with you. Thousands of websites claim to sell Health Canada approved medicines, but none do consistently to US consumers. And if they get it right one time, chances are they'll hook you by doing and selling you a legitimate prescription first, and then they'll sell you counterfeit later. US consumers and healthcare providers can't tell the difference like I just showed you. We lean on our med use process. We lean on our physicians. We lean on our pharmacists to help patients make good choices, and it looks like right now we can't do that. And so there's no way to ensure the products sold by foreign sellers are safe and effective. And for me personally, as a patient safety advocate and expert, patient safety is fundamental to healthcare, right? You go in thinking you're going to get better, not worse. But drug importation and going down this road makes my job and the job of health professionals increasingly difficult. So with that, I want to turn it back over to Libby, and I'm happy to answer questions, I think, at the conclusion of the briefing. Thank you very much.